Yeah, so in this pilot, we were aiming to identify key changes in digitally captured patient biometric as well as self-reported quality of life outcomes pre and post hospitalization of patients with sickle cell disease. And what you'll be doing is you'll monitor patients for a longer time virtually, and can we keep track of what's going on with them? The overall aim would be to prevent readmission. So in this pilot, we looked at 93 patients with sickle cell disease who were enrolled in our digital ecosystem where they self-recorded the hospitalizations over the last 12 months. So we looked at those episodes and compared the variabilities between 1, 3, and 7 days before the hospitalization, the day of the hospitalization, and the post-hospitalization baseline characteristics. And what we see is that actually looking at the activity, I mean, the main patients, they were aged 33, average age of 33 years, 73 of them with females, and 84% were HPSS genotype. The amount of steps that patients do prior to the hospitalization significantly dropped prior to them getting into the hospital, and interestingly, post-discharge were rising again. So patients were more active in terms of after being discharged or being discharged. We also looked at EQ5D scores, so how were patients feeling, and understandably there were significant differences here with patients feeling low during the date of the hospitalizations. I would say that patients overall were very, very fatigued. This was again dipping before the hospitalization. During hospitalization, patients would sleep less well and also have more times waking up overnight. And that was actually quite significant. And the 7 days post-admission, the sleep was kind of picking up again. So we have revealed trends that the quality of life during the pre and post hospitalization is obviously changed when patients have been admitted, and it would be very interesting to integrate this fully with the hospitalizations medical records to unpick, if the patient reported outcomes is linked to anything that happened during the admissions. But equally, the post-admission follow-up will allow you to track patients in a virtual hospital where we ideally want to prevent any readmissions. So we need to expand the current analysis around the biometrics as such. In addition, having the patient having their wearable watch and them being in control of their patient-reported outcome, it will empower them about their condition and in this way improve their health outcome. So in an ideal situation where healthcare providers can kind of collaborate and having insight into this data, we hope that we can promote a fast recovery post-discharge and prevent readmissions.